we open up our roundtable right now, so I'd welcome back Dr. Agyapong and Dr. Metz, but let me address my first couple of questions quickly to Dr. Hill, if I can.
Sure.
First of all, the fact that you've had the ESCAPE trial and now this new drug, when you said 25 years ago you couldn't really do anything, I think it may seem slow to you, but boy, in the context of the development of medicine, it's been pretty fast. I think that if people are familiar with the ESCAPE, the most dramatic part is actually going in and physically pulling the clot out of the brain. But I noticed in your 1 to 10 steps that the first 6 or 7 happened before even getting to the hospital. And boy, that could you just speak to that a little bit, the importance of all these other elements, including EMS and everything else, that would allow this technique to work?
Yeah, it's a great point. Thanks, Jay. I mean, perhaps the hardest thing about stroke is that if you are affected by a stroke, certainly a major one, very often that renders you incapable of getting help for yourself. Either you can't speak, or you can't move, or you can't dial a telephone. Because of course the brain is the thing that you're going to use to call for help. So it relies on family members and bystanders to recognize what's going on and get help, right? And yes, so you have to identify that you're having a problem, or someone does. You have to call the paramedics. They have to get to you. They have to recognize it and get you to the right hospital as well. And we have a well-established system throughout Alberta to get patients to the right hospital. So even if you're in a rural area, there's a mechanism and a plan already in place, ready for you. And it's obviously harder if you're in a more remote area because there's a distance which equates to delays in time. But we have got this set up to get people into either Edmonton or Calgary for this kind of treatment as required. But you're absolutely right. And delays in therapy or delays in arrival are probably the biggest thing that prevents us from getting more people home.
Do more men get strokes than women?
No, it's 50-50 pretty much, although the ages are different, right? So women tend to have more strokes a little older than men, but no, it's about the same.
Dr. Metz, welcome back. There's a question that came in from the audience. Does this study, and I guess that could cover more than one study, include antisocial people or those on the autism spectrum? Because I guess the question is, how do such people respond or either suffer from lack of social contact or respond better to it?
This is a really great question. And most of the research so far, and especially right now, focus actually on elderly. And I think there's definitely an influence interaction with psychological conditions, psychiatric conditions. So these are great questions. And there's definitely an effect. I mean, there's actually special care and needs when someone has a condition like autism, for example. There would be mitigation therapies that really address that in a very targeted manner. And so I'm very sure that social isolation has probably in this vulnerable population an even larger effect than what we see in the general population.
And if I could address another question that also targets a vulnerable population, COVID has created tremendous isolation for people living in long-term care. Are you aware of any studies that explore this aspect of isolation?
Yes, and this is actually, I think, going on right now across Canada, within Alberta, and around the world. There's a lot of concern right now because long-term care homes, senior homes, and so on, they are very much affected by the social isolation, by the physical distancing from family members that are so important for interaction, and maintaining mental health is really a central issue. So there are studies around this. And actually, speaking about Alberta in particular, there's a lot of really great research going on at the universities of Calgary and universities of Alberta, addressing social isolation effects in pregnant women as well. So I think every age group across the spectrum is something that we have to be concerned about. And we talk about schools and how to deliver in-person, in-face classes. It's really the entire range is affected, but senior homes are actually met by this paradox because they're highly vulnerable to infections. And so they need even more care around the physical distancing, yet it really hampers their mental health especially. So it's a very difficult situation at the older ages spectrum.
Yeah, and it's kind of interesting that there are some issues that all three of you have to address. And one of them is access, getting people with stroke to hospital quickly. And here's a question for Dr. Agyapong. What has helped spread awareness of Text for Hope so people know it exists, especially in rural communities? If you're there, you go.
Yeah. So, I mean, when it was launched initially, it was launched by Dr. Dina Henshaw. So, I mean, those who were listening to her on the day actually signed up a lot. And within a week, we had over 32,000 people subscribing. Subsequently, it's advertised on the website of our Alberta Health Services, as well as the mental health, the various foundations who sponsored it. And there are occasional social media tweets and stuff like that. But I'm not sure that really people that need to actually hear about it are hearing about it, because as I indicated, people come to our clinic. I work at the Access 24/7 clinic, and I sign people up in my office on a daily basis, and they've never heard about it. So I think that's some work that needs to be done, and the government, there's a meeting, I think, next week, and there's going to be renewed effort in getting people to know more about this.
And actually, I think one of the good qualities about it is you don't really have to do a lot to participate. And so people who are, feeling so isolated that kind of induces an inertia to, act on it, are reachable by this. And are you either planning or actually sending these text messages out in different languages?
Yeah, so I mean, just last week, Alberta Health Services, we're working together. We secured some funding from RBC Canada to launch a national Arabic version of the Text for Hope program. So we are using the opportunity to also launch, hopefully, the French and the Chinese, as well as the Punjabi versions initially. So we do expect this to happen sometime. I think we have the 5th of April as the probable launch date for the different languages.
Well, I mean, governments should certainly be listening because you have the data to support it. Dr. Hill, you talked mostly about strokes caused by clot, but that you also indicated 15% of them are the result of brain bleeds. Is there progress being made in those?
Yeah, thanks. That's a tough question, because the progress has been much slower and much harder to sort out. So, broadly speaking, a little bit. We've been able to show that certain types of medical therapies are helpful. For example, treating blood pressure, or sometimes providing medications that are useful for actually stopping the bleeding, right? So clotting medicine, so to speak. But perhaps the biggest thing that's happened over, say, several decades is people are treating blood pressure is much better controlled in society. And high blood pressure is the #1 cause of bleeding, of bleeding types of strokes. So if we look over time, diets are a bit better. I think certainly in North America, blood pressure is treated better and recognized better. So people are doing that. We also probably there's a little bit less of some drug-related stuff. So we see, cocaine and crystal meth are important causes of bleeding types of strokes, and we've seen a little bit less of that. So, I think overall in that way, we've actually seen a decline in the numbers of bleeding types of strokes overall in Canada and in Alberta.
And another question for you, comes from the audience, what other factors other than timely treatment contribute to stroke patients' better long-term outcomes?
Well, I mean, I think there's a number of them. One is your general health overall. So if you come into a major illness, it's true of stroke and it's true of all illnesses, in a better state of affairs than somebody else, then you're likely to come out of it better. But there are other features. For example, diabetics don't do quite so well. People with high blood sugar at the time of stroke tend to have more damage, so we pay attention to that. There are technical factors. How well did we get the artery open, and that kind of thing? How well did we control the blood pressure? There are also factors about recovery that are really important and appear to different. I mean, recovery and rehabilitation from stroke are, when there is damage, how do you get the brain to get better? And the brain does heal and it does regenerate itself to some extent, and there's lots of things to be discovered there, and people react to those things quite differently. Family support matters a lot, right? And probably a fun one, when we've been talking about a lot of mental health issues, but your baseline mental state matters, right? If you are stubborn, determined, right, you're going to recover a lot better than if you give up and don't have a go at it.
We have just about a minute left, and there is a question here that I think for you, Dr. Metz. I'm curious as to why men were better at adapting to social isolation.
This is a really good point. I don't think there's been a lot of research about dissociating the particular pathways here, but I think evolutionarily we have to look at the roles here, that in terms of also the functions of oxytocin, that there's very different responses in females to oxytocin, and responses to social environments as well. And so that could be, we could discuss for an hour about this, because this is really interesting. There's a lot of animal basic research about this, but in humans, I think we still have to learn a good lesson about this.
Well, thank you very much, and thank all three of you, Dr. Hill, Dr. Metz, Dr. Agyapong. As I've been saying all day, another fantastic session. So thank you.